Are you currently receiving Medicare benefits? Then you need to pay close attention because major changes are coming your way in 2026 and beyond. The government has recently rolled out more than a dozen press releases and comprehensive fact sheets detailing significant modifications to both Medicare and Medicaid programs. And let me tell you, some of these changes are absolutely game changing. Here's what you need to understand: some of these updates will work in your favor and could save you money. Others might increase your costs or limit your options, but here's the crucial part: many of the most important decisions haven't been finalized yet. Right now, at this very moment, the Centers for Medicare and Medicaid Services is actively seeking public feedback. They genuinely want to hear from you, and this represents a critical window of opportunity to make your voice heard. Why does this matter so much? Because if everyday people like you and me don't speak up, the insurance companies will be the ones shaping these rules. And we all know that their priorities and profit motives may not exactly align with what's best for your healthcare and your wallet. This is your chance to influence policies that will directly impact your life, your health, and your financial security. Today, we're going to walk through everything you need to know. We'll cover what changes have already been finalized, what's still up for discussion, and most importantly, exactly how you can make your opinion count. Now, I should mention that the government released a massive amount of information, much of it highly technical, dense, and frankly, pretty tedious to read through. We've done the heavy lifting for you and filtered out the updates that don't really affect your day-to-day life. If you're someone who enjoys diving into the nitty-gritty policy details, you can find all the complete documentation on the official CMS website. Before we dive in, I need to give you an urgent reminder if you're currently on Medicare. We are in the final days of open enrollment. You only have until December 7th to make any adjustments to your plan for 2026. If you haven't already reviewed the changes to your current coverage, examined what's happening with your plan, and explored what other options are available to you, now is the time to act. I strongly encourage you to reach out to a qualified Medicare advisory service. Many offer free consultations where they can review all the different plans available in your specific area and ensure that your doctors, your medications, and all of your healthcare needs will be properly covered as we transition into the new year. And let's be honest for a moment, Medicare is incredibly complicated, more complicated than it needs to be, in my opinion. There are literally over 20,000 different Medicare plans out there across the country. Every single one of them changes their coverage and costs every year. It's overwhelming, confusing, and frustrating for most people to navigate. I'd love to hear your thoughts on this. Do you think Medicare is too complicated? Drop a comment and let me know, because I'm genuinely interested in hearing your experiences and opinions. All right, let's dive into the details and talk about what's already changing. These are the modifications that have already been issued as final rules. These are done deals. They're happening whether we like them or not. After we cover all the changes that are definitely going into effect, we'll discuss what's still being debated and how you can influence those decisions that haven't been finalized yet. Let's start with the reality that nobody wants to hear, but everyone needs to know. Medicare costs are going up in 2026. The government has released the new cost schedules for Parts A and B, and unfortunately, we're looking at higher deductibles and higher premiums across the board. For people living on fixed or limited incomes, this is going to make budgeting for healthcare even more challenging than it already is. It's absolutely critical that you understand what's coming before these changes take effect on January 1st. Here are the specific numbers you need to know. The Part A hospital deductible is jumping to $1,736. That's the amount you'll pay out of pocket before your hospital insurance kicks in. The new standard Part B premium will be $185.90 per month. Yes, you read that correctly. That's a significant increase that will impact millions of Medicare beneficiaries. Now, if you're on a low or fixed income, please don't panic. There are other programs and assistance plans available that can help you cover these out-of-pocket costs. Medicare savings programs, extra help for prescription costs, and other state-specific assistance programs exist specifically to help people in your situation. A qualified Medicare advisor can help you determine what you might be eligible for and walk you through the application process. I won't spend too much time rehashing all the details about these cost increases because there's plenty of other information available on that topic. Let's move on to some of the positive changes that are coming. Here's something to celebrate. CMS has successfully negotiated lower prices on 15 major medications that are used to treat cancer, diabetes, asthma, and various other chronic conditions. This brings the total number of medications with negotiated lower prices to 25. This is a huge win for Medicare beneficiaries who depend on these drugs. Here's how the rollout will work. The first 10 medications that were negotiated will see their lower prices go into effect on January 1st, 2026. That's coming up very soon. The additional 15 medications that were just negotiated will switch to their reduced prices on January 1st, 2027. To put this in perspective, approximately 5.3 million people on Medicare relied on these medications in 2024, and these drugs accounted for roughly 15% of all Part D spending. So these price cuts should bring substantial financial relief to a large number of people. I'm genuinely excited to see how much money this could save for those of you who depend on these medications. Here's another positive development. Certain clinic costs are also being reduced. Currently, Medicare pays significantly more, and you pay more out of pocket if the services you receive are provided in a hospital-owned clinic versus a regular doctor's office, even if the facilities are essentially identical. This has always seemed unfair and illogical. Starting in 2026, CMS is implementing a new policy where they'll pay doctor's office rates even if you're receiving care at a hospital-owned clinic that looks and functions exactly like a regular doctor's office. Medicare won't continue paying premium rates simply because the clinic happens to be owned by a hospital system. This is excellent news because it should directly lower your coinsurance costs when you receive care in those settings. The financial impact is substantial. Medicare is projected to save $220 million through this change, and more importantly, patients like you are expected to save around $70 million in co-insurance costs in the upcoming calendar year alone. If you regularly receive your care at a hospital-affiliated clinic, this could mean real savings for you. Eliminating the inpatient-only list. Here's a change that might not seem significant at first glance, but it could have a major impact on both your experience and your wallet. The government is beginning to phase out what's called the inpatient-only list. This was a list of surgical procedures that could only be performed if you were admitted to the hospital as an inpatient, requiring an overnight stay or longer. CMS has determined that medical practice has evolved significantly, and many of these procedures can now be safely performed on an outpatient basis with shorter recovery times and less risk to patients. They're starting this transition by removing 285 procedures, mostly musculoskeletal procedures, from the inpatient-only list in the upcoming calendar year. What does this mean for you? If you need one of these procedures, you could potentially have a much shorter hospital stay, get home sooner, and experience lower out-of-pocket costs. This last point is particularly important because hospital deductibles can be extremely high. We're talking thousands of dollars. Having a procedure done on an outpatient basis instead of requiring an inpatient admission could save you a substantial amount of money. Related to the previous change, the government is also loosening restrictions on what types of surgeries can be performed in ambulatory surgical centers, or ASCs. These are specialized facilities designed specifically for surgical procedures that don't require an overnight hospital stay. Why should you care about this? Because ASCs typically charge significantly lower rates than traditional hospitals for the same procedures. This means lower copays and lower out-of-pocket costs for you as a patient. If you need one of these procedures, given how expensive healthcare has become, it's refreshing to see policy changes that could actually reduce costs for a lot of people. This is one of the changes I'm most excited about because it addresses one of the biggest problems in American healthcare, the complete lack of price transparency. Starting in 2026, hospitals will be required to provide meaningful, accurate, and specific information about the amounts they charge for healthcare items and services. But here's what makes this rule really powerful. Hospitals won't be able to just post some vague list prices that nobody actually pays. They'll have to post real dollar amounts, including the median amount actually paid by insurance companies, as well as the 10th percentile and 99th percentile rates. This means you'll see prices that actually reflect what insurance companies are paying, not just made up charge master prices that bear no relationship to reality. This transparency will empower you in several important ways. You'll be able to price compare between different hospitals before you schedule a procedure. You'll be able to spot potential overcharges on your bills more easily, and you'll have the information you need to push back when a bill doesn't look right or seems excessive. The rule is finalized and will take effect on January 1st, 2026. However, CMS has announced they won't start actively enforcing all aspects of the rule until April 1st, 2026, giving hospitals a grace period to get their systems updated. Still, this is a major step forward for healthcare transparency, and I encourage you to take advantage of this information when it becomes available. The government is also expanding competitive bidding for durable medical equipment, prosthetics, orthotics, and medical devices. More competition generally means lower prices, and this new bidding program is expected to drive down costs starting in 2028. What kind of equipment are we talking about? Common supplies that many Medicare beneficiaries depend on, including glucose monitors, insulin pumps, catheters, braces, wheelchairs, hospital beds, and more. Lower costs for these items could translate into lower copays for you. There are some additional improvements being implemented as well. To eliminate the hassle of hunting for approved suppliers, certain items will now be shipped nationwide directly to patients. This is particularly beneficial for people living in rural areas who have historically had difficulty accessing medical equipment suppliers. Another significant change: continuous glucose monitors and insulin pumps are being moved to a monthly rental model rather than requiring large upfront purchases. This will dramatically lower your upfront costs if you need this equipment. Better yet, all of your supplies are supposed to be included in that monthly rental payment. No more surprise bills for sensors, infusion sets, or other accessories. Medicare will also be capping the maximum rental price to prevent costs from getting out of control. We're also seeing some changes in the home health sector. On one hand, Medicare is going to be reducing the payment rates to home health agencies, which is concerning because it could potentially impact the availability or quality of services. However, on the positive side, they're simultaneously making it easier to qualify for home health services in the first place. There's also an interesting administrative change. They're removing questions about food security, living situations, and utility access from the Home Health Quality Reporting Program survey. We've actually seen them make similar changes across many different types of healthcare surveys. It's worth noting this trend, though the reasoning behind it isn't entirely clear. Finally, the government is making radical changes to how healthcare providers bill for skin substitutes. This change is being driven by the rampant fraud and abuse that's been discovered in this particular area of billing. Without getting too deep into the weeds, just know that this is about cracking down on fraudulent practices that have been costing the Medicare system and ultimately taxpayers significant amounts of money. Now, everything we've discussed so far consists of final rules, changes that are definitely happening, but what I want to talk about now are proposed changes that are still under consideration. Some of these proposals could be very helpful to you. Others might not be in your best interest at all. This is why it's so important that you understand what's being discussed and that you take advantage of this opportunity to make your voice heard. Let's go through these proposals one by one. First up, CMS is proposing significant updates to how Medicare Advantage plans and Part D plans receive their star ratings. These ratings are supposed to help you evaluate and compare different plans, so changes to how they're calculated could affect your ability to make informed decisions. The proposal includes removing 12 different metrics from the rating system while adding a new measure focused on depression screening and follow-up. This new measure would start in 2027 and would fundamentally change how these plans are evaluated and graded. But here's a change that's particularly concerning. They want to stop the implementation of what was called the Health Equity Summary Score, or the Excellent Health Outcomes for All Reward. This measure was specifically designed to give extra credit to plans that were providing exceptional care to people with certain social risk factors. Things like poverty, dual eligibility for Medicare and Medicaid, limited English proficiency, or living in high need communities. The whole point of this measure was to identify and reward plans that were going above and beyond to serve particularly vulnerable populations. Scrapping this as a quality metric seems like a step backward in terms of ensuring that disadvantaged populations receive high quality care. This is definitely something worth commenting on if you have strong feelings about health equity. Special enrollment for provider network changes. Here's a proposed change that I think is actually really positive. They're considering creating a new special enrollment period for situations where one or more of your providers leaves your plan's network. Currently, if your doctor drops your insurance plan in the middle of the year, you're generally stuck until the next open enrollment period, which means you either have to find a new doctor or pay out-of-network costs to continue seeing your preferred provider. The existing rules do allow for mid-year plan changes in cases of significant network changes, but there's a catch. Both the Medicare Advantage organization and CMS have to agree that the change was significant enough to warrant a special enrollment period. The new proposal would eliminate that requirement for agreement. You wouldn't have to get both parties to agree that losing your doctor constitutes a significant change. This would make it much easier for you to switch plans mid-year if your doctor or another important provider is no longer in your network. For people who have established relationships with their healthcare providers, and let's face it, that's most of us, this could be a huge improvement. The ability to follow your doctor to a different plan without waiting months for open enrollment could ensure continuity of care and preserve important patient-doctor relationships. Requests for information on Medicare Advantage CMS is also asking for public input on several different aspects of Medicare Advantage that they're considering changing. These are called Requests for Information, or RFIs, and they represent areas where the government is genuinely seeking ideas and feedback before making any decisions. Helping smaller plans compete. First, they want feedback on how to improve the Medicare Advantage marketplace so that smaller plans with better benefits can compete more effectively against the giant insurance companies. This is important because more competition generally leads to better benefits and lower costs for consumers. If you have ideas about how to level the playing field and promote more competition, this is your chance to share them. Artificial intelligence in healthcare decisions. Here's one that I know will raise concerns for many of you. CMS is exploring what they call modernization opportunities, specifically including the development of a next-generation risk adjustment model that could leverage artificial intelligence and alternative data sources. In plain English, this means they're considering using AI to make decisions about your healthcare and how much your treatment should cost. I know from reading comments and talking to people that many of you have serious concerns about having artificial intelligence making decisions about your medical care. If you feel strongly about this, either positively or negatively, this is your opportunity to let CMS know. Don't assume they understand the concerns of real patients unless you tell them directly. Dual eligible beneficiaries. They're also seeking feedback on how to better serve people who qualify for both Medicare and Medicaid. These are called dual-eligible beneficiaries. The data apparently shows that many dual-eligible people are enrolling in CSNP plans, chronic condition special needs plans, when they would actually be better served by DSNP plans, dual-eligible special needs plans, which can provide better coordinated benefits that integrate both Medicare and Medicaid coverage. CMS is asking for ideas on how to address this problem. Should they require certain plan providers to sign Medicaid contracts? Should they implement stricter rules about how these plans are marketed to vulnerable populations? Should they create additional safeguards to ensure people don't end up on plans that leave gaps in their coverage? If you have experience with this issue or ideas about how to solve it, please share your thoughts. Meaningful supplemental benefits. Finally, CMS wants your feedback on whether Medicare Advantage plans should be encouraged or required to offer supplemental benefits that genuinely improve quality of life. Things like mental wellness support, nutrition assistance, programs that promote social connection, and other benefits that provide a real sense of life satisfaction and well-being. They're specifically calling out the fact that many plans currently offer what they call flashy supplemental benefits, things that sound good in marketing materials but don't necessarily provide meaningful wellness support. Think about your own experience with supplemental benefits. Have they actually improved your life and health, or are they just gimmicks? CMS wants to know how these benefits could be improved to provide real value to beneficiaries. There's another set of proposals that focus specifically on Part D prescription drug coverage. One major proposal would make permanent the temporary changes that were included in the Inflation Reduction Act. This would include permanently eliminating the coverage gap, the infamous donut hole, permanently lowering the annual out-of-pocket caps on prescription costs, and other consumer-friendly changes. Making these changes permanent rather than temporary would provide certainty and long-term financial protection for people who depend on expensive medications. This seems like an obvious win for beneficiaries, but insurance companies may have different opinions, which is why your voice matters. Here's a proposed change that could directly affect you, and frankly, it's one that concerns me. CMS is proposing to eliminate the requirement that Medicare Advantage plans send you mid-year notices about unused benefits. Let me explain why this matters. When this notification requirement was first implemented, I thought it was a great idea. Here's how it works. If you go half the year without using all of the benefits and perks that your plan provides, things like dental visits, vision exams, over-the-counter allowances, gym memberships, or whatever else your plan includes, the insurance company is required to send you a notice reminding you about what you haven't used yet. This gives you the opportunity to actually take advantage of the benefits you're paying for before the year ends and they expire. Now, the insurance companies are saying that sending these notices is burdensome and creates unnecessary administrative hassle. They want to eliminate this requirement so they don't have to send these letters anymore. Think about what this means from the insurance company's perspective. If you forget to use your benefits, they save money. They get to collect your premiums while spending less on actually providing you with care. From your perspective as a beneficiary, these reminder notices help ensure you're getting full value from your plan. This is a perfect example of where the interests of insurance companies and the interests of beneficiaries are directly opposed. If you value these reminder notices and want to keep receiving them, you need to say so. Otherwise, the insurance company's preference to eliminate them might win out. CMS is also generally seeking input on approaches and opportunities to streamline regulations and reduce burdens on those in the Medicare program. This sounds innocuous, and in some cases, eliminating unnecessary red tape can be genuinely helpful. However, it's important to think carefully about which regulations actually protect you as a patient versus which ones are truly just unnecessary paperwork. Not all regulations are bad. Many exist specifically to protect you from being taken advantage of, to ensure you receive quality care, or to guarantee transparency and accountability. When CMS talks about reducing burdens, they might mean reducing burdens on you as a patient, but they might also mean reducing regulatory burdens on insurance companies and healthcare providers, which doesn't necessarily work in your favor. If you have thoughts about which rules and regulations are genuinely helpful versus which ones could be eliminated without harming patients, this is your chance to share those perspectives. These requests for information represent the only times that CMS openly and explicitly asks the general public for input on changes they're considering. This is your window of opportunity. If regular people like you, low-income beneficiaries, caregivers, patient advocates, and those who actually use the Medicare system every day don't speak up, then the only voices CMS hears will be from the big insurance companies and healthcare corporations, and trust me, those companies are definitely making their voices heard. They have teams of lawyers, lobbyists, and policy experts whose full-time jobs are to influence these decisions in ways that benefit their bottom lines. You already know what they want: higher profits, fewer requirements, less regulation, and more freedom to deny claims and limit benefits. If you have concerns about how your healthcare works, ideas about how it could be improved, thoughts about the specific changes that have been proposed, or opinions about what CMS should prioritize, this is your moment to say so. Your voice matters, your experience matters. Your perspective as someone who actually depends on Medicare for your healthcare matters enormously. Now, I'll be honest with you. The links to submit comments through the Federal Register website are long, complicated, and not exactly user-friendly. The government hasn't made it easy to participate in this process, which is probably part of the reason why so few regular people actually submit comments. To make this easier for you, you can search for the specific Federal Register notices by their document numbers or titles. Look for the CMS proposed rules for 2026 Medicare Advantage and Part D, as well as the separate proposed rule regarding Part D improvements. Each of these will have a Submit a Formal Comment button where you can share your thoughts. You don't need to be a policy expert to submit a comment. You don't need to use fancy legal language or cite regulations. What CMS needs to hear is your actual experience as a Medicare beneficiary, your concerns about the proposed changes, and your ideas about what would make the system work better for real people. When you submit a comment, be specific. If a proposed change would help you, explain how and why. If a proposed change would hurt you or make your life more difficult, describe the impact it would have. Share your personal story, explain what matters most to you about your healthcare coverage. These personal narratives are often more powerful than abstract policy arguments. I want to take a moment to remind you about the importance of having good support and guidance as you navigate all of these changes. Medicare is complicated enough under normal circumstances. There are literally tens of thousands of different plan options across the country. Every single plan changes its coverage, costs, and provider networks every year. Keeping track of all of this is a full-time job, and it's not reasonable to expect ordinary people to become Medicare experts on top of everything else they have going on in their lives. This is why working with a qualified, independent Medicare advisor can be so valuable. Good advisors have access to comprehensive databases that allow them to compare all of the plans available in your specific area. They can look at your particular situation, your doctors, your medications, your health conditions, your budget, and help you identify which plans would provide the best coverage for your specific needs. I've heard from so many people who have had positive experiences working with Medicare advisors. People who were dropped by their insurance and needed help getting back on a plan. People who discovered they were eligible for additional benefits they didn't even know about. People who were able to get better dental and vision coverage, higher over-the-counter allowances, or plans that included their preferred doctors and medications. These aren't random testimonials. These are real stories from real people who were feeling overwhelmed by Medicare's complexity and found genuine help. One person mentioned spending 2 hours on the phone with an advisor going through all of her options and ending up with better coverage in multiple areas. Another person was able to get back on Medicaid coverage she didn't realize she qualified for. The deadline for open enrollment is coming up fast. December 7th is just days away. If you haven't reviewed your coverage for 2026, if you're not sure whether your current plan is still the best option, or if you're just feeling confused and overwhelmed by all of these changes, please reach out to a qualified advisor. Most offer free consultations, and they can help ensure you're getting the best possible coverage as we move into the new year. I know that if you're concerned about Medicare, you're probably also worried about Social Security benefits. These two programs are interconnected in many ways. Most people who receive Medicare also depend on Social Security for at least part of their income. And just like Medicare, Social Security is also facing potential changes and ongoing political debates about its future. There are several bills currently being proposed in Congress that could significantly change Social Security benefits, eligibility requirements, and cost of living adjustments. Some of these proposals would strengthen Social Security's finances and potentially increase benefits. Others could lead to benefit cuts or higher eligibility ages. It's important to stay informed about these proposals as well, so you can advocate for policies that protect your financial security. We've covered a lot of ground today, and I know it can feel overwhelming. Medicare is a complex system, and the fact that it's constantly changing makes it even harder to navigate. But here's what I want you to take away from this discussion. First, real changes are coming to Medicare in 2026. Some will help you, some might hurt you, and you need to be prepared and informed. Second, many important decisions haven't been finalized yet, and this is your opportunity to influence those decisions. Third, you don't have to figure all of this out alone. There are resources, advisors, and support systems available to help you navigate these changes and make sure you're getting the coverage you need. And finally, your voice matters, your experience matters. Your healthcare is too important to leave to insurance companies and bureaucrats without any input from the people who actually depend on these programs. So please take a few minutes to submit comments on the proposals that affect you. Reach out for help if you need it. Review your coverage before the enrollment deadline and stay informed about the changes that are coming. Healthcare is a fundamental part of life, especially as we get older. You deserve a system that works for you, treats you with dignity, provides the care you need, and doesn't bankrupt you in the process. By staying informed and making your voice heard, you're not just helping yourself. You're helping to shape a better Medicare system for everyone who depends on it now and everyone who will depend on it in the future. Thank you for taking the time to learn about these important changes. I hope this information helps you make informed decisions about your healthcare coverage and empowers you to participate in the policymaking process. Your health matters, your financial security matters, and your voice matters. Don't let anyone tell you otherwise.